Hi, I am Dr. Hajin Kim. A primary spontaneous pneumothorax has occurred on the right side of the chest. A pneumothorax commonly occurs in tall, thin males in their 20s, usually caused by air sacs forming at the top of their lungs. The exact cause is unknown, but whatever the cause may be, if the air sacs explode, air will leak into the chest. If air accumulates in the space between the lung and chest wall, the lung will collapse and cause chest pain and discomfort. Treatment will involve chest tube insertion. A thin tube will be inserted into the chest to remove the excess air and cause the lung to inflate again. It will alleviate symptoms of chest pain and shortness of breath. We will be able to observe the excess air leaking through the inserted tube. After the chest tube insertion, all of the excess air has been removed and the lung has returned to its original state. In most cases, the ruptured air sacs take 1 to 2 days to heal after the removal of excess air. Once they completely heal, the air leakage will stop and the patient will be able to remove the chest tube and be discharged. Currently, there is persistent air leakage through the inserted chest tube. This means that the air sacs have not completely healed and the air is continuously leaking into the chest cavity. We do not recommend removing the chest tube as it will cause excess air to accumulate in the chest cavity and cause another pneumothorax. The best treatment method would be to surgically remove the ruptured air sacs. Although general anesthesia is required, it is a relatively simple surgery. An endoscope will be inserted through 2 to 3 1 centimeter wide incisions in order to examine the thoracic cavity. We will then remove the ruptured air sacs along with surrounding normal lung tissue. The amount removed will be minimal and should not affect lung function. Patients are usually discharged after 2 to 3 days post-surgery. Pneumothoraxes are prone to reoccur. Although the first pneumothorax has been treated well, there is a 30% chance of recurrence. Smoking increases the chances of recurrence and should be avoided. Recurrent pneumothoraxes are even more prone to recurrence. The chances of pneumothorax occurring increases by over 50% after a second recurrence. In this case, surgical treatment is required. Although general anesthesia is required, it is a relatively simple surgery. An endoscope will be inserted through 2 to 3 1 centimeter wide incisions in order to examine the thoracic cavity. We will then remove the ruptured air sacs along with surrounding normal lung tissue. The amount removed will be minimal and should not affect lung function. However, there is no need to come in for regular checkups because you are worried about a pneumothorax recurrence. Pneumothorax symptoms are so specific that if a pneumothorax does recur, you will have the exact same symptoms you have experienced the first time and will be able to tell right away. If you experience those symptoms again, please visit the ER. The chances of a pneumothorax occurring increases by over 50% after a second recurrence. In order to prevent recurrence, it must be treated surgically. In this case, a surgical treatment is required. Although general anesthesia is required, it is a relatively simple surgery. An endoscope will be inserted through 2 to 3 1 centimeter wide incisions in order to examine the thoracic cavity. We will then remove the ruptured air sacs along with surrounding normal lung tissue. The amount removed will be minimal and should not affect lung function. Patients are usually discharged after 2 to 3 days post-surgery.